digital seminar on return to work strategies post-lockdown during COVID-19. Just a couple of pointers before we start. If you could look at the bottom of your screen, you have a couple of options in the panel below. One is the mute option. Please make sure to keep your cell phone mute till our Q&A session. Then, if you would like to join us via video as well, please press the start video option. We also have a chat option. If you look at the middle of the panel, please utilize this if you want to ask any questions that you would like to during the session, directed to either of our speakers. Also, please mention your name and which company you're from, just so that we know who you are. And apart from that, we have a reacts button, and that's about it right now for this session. I'd like to introduce Mr. Nandan Bhatia from Arogya World. He'll be our moderator for the session. Over to you, Nandan.
Thank you very much, Shima. So we will start in next 2 minutes.
Hi, good afternoon, Nandan. Hello.
Good afternoon.
Yeah, how are you?
Good, Loknath. Thank you very much for joining. So we will be starting in next 1 minute.
Okay. Good afternoon, Mr. Nandakumar Jairam. This is Loknath here from CII.
Doctor is in mute actually.
Okay.
Hi. Yeah, okay. I'm unmuted now. Good afternoon.
Good afternoon, sir. So we'll just start in another 2 minutes, sir. 1 minute.
Sure.
Is Mr. Narayanan has joined?
Yes, Nandan, I'm here.
Oh, good afternoon, sir.
Good afternoon.
Okay, great. So we will start now. Thank you very much, everyone. Very good afternoon to all of you. We welcome all our members in this digital seminar hosted by CII Karnataka and Arogya World India Trust. Today's seminar topic is return to work strategies post-lockdown during COVID-19. And to address this, we have our eminent panel speakers, Mr. Ramkumar Narayanan and Dr. Nandakumar Jairam. To introduce myself first, my name is Nandan Bhatia. I will be the moderator for this seminar today. I am currently with Arogya World India Trust as senior consultant, and I took this role in January 2020. And prior to this, I was head of workplace services for Britannia Industries for a decade and possess expertise of 11 years of operations and sales stint in IT and hospitality sector, like Technologies, Leela Palace, and ITC Windsor Sheraton Hotel. I am instrumental in operating and developing large facilities with maximum efficiency, safety, employee comfort, and effective client relationship. In fact, I have led a lot of initiatives towards building Britannia's zero waste organization countrywide on issues, technology, and solutions to handle solid waste management system under environment and sustainability. And this initiative has led Britannia to win the prestigious Nama Bangalore Awards, BCIC, SDCRF, UL Cyberpark, FM Zone India Leadership Award, and so on and so forth, along with Karnataka Seva Ratna Award. Now it gives me a great pleasure to introduce our esteemed speakers who are the leaders in the corporate field of IT and healthcare. To start with, I would like to introduce Mr. Ramkumar Narayanan, who is a global leader focusing on data-driven digital product innovation spanning consumer and enterprise markets. He brings a vast experience in product development, product management, and product marketing, having led both new market entry and turnaround of existing business areas. He has been an advisor to enterprises, large and small, in the arena of digital transformation, product strategy, and product marketing. Ram is currently the Vice President and Managing Site Director, R&D at VMWare India. Prior to joining VMWare, he has served in global leadership positions at eBay, Yahoo, and Microsoft. He is currently also a member Executive Council of NASSCOM and member Governing Council of Derby Foundation, which is Dayanand Sagar Entrepreneurship Research and Business Incubator. Ramkumar holds a BE in Mechanical Engineering from Anna University, Chennai, MS in Mechanical Engineering, and MBA from University of Michigan, Ann Arbor. Welcome, Ram. Thank you very much for being in this panel today in this digital seminar.
Thank you, Nandan.
Dr. Nandakumar Jairam currently is the Chairman, CEO, and Group Medical Director for Columbia Asia Hospitals in India. He was the Chairman of the NABH under the auspices of QCI, which is Quality Council of India, and past Chairman of the Health Services Committee of FICCI. He founded Krishna Charitable Trust. Dr. Nandakumar is trained in colorectal and minimally invasive surgery. He is an alumnus of Bangalore Medical College, and he has several papers, including publications in the prestigious British Journal of Surgery and presentations to his credit. He was awarded the FRCS in 2017 and awarded as a Healthcare Personality of India by FICCI in 2017 and the Lifetime Achievement Award by Alert in 2019. Welcome, Dr. Nandakumar. Thank you very much for joining for this session today.
Thank you for that introduction.
I would like to now introduce Arogya's presence in the country. And Arogya World, as you are aware, is a global non-profit organization which is working towards prevention of non-communicable diseases through health education and lifestyle change. The non-profit follows a doorstep health model, taking prevention to where people live, learn, and work. I would request members to visit india.arogyaworld.org for more information about Arogya World as an organization in the country. There are a couple of flagship programs what Arogya is executing in the country, and I'm honored to talk about those. The first one is M Diabetes, which is Arogya's flagship 1 million person diabetes prevention M health program in India, which uses simple text messages to educate 1 million people, helped 150,000 people to lead a healthier life. Another program, which is a flagship again, is a school initiative which Arogya has executed, which widely spread in many states, which is a proven of 2 years peer-led program designed for middle school, which is for the age of 11 to 13 years, children in class 6 to 8. It is an innovative and engaging activity-based behavior change model on health and wellness, especially on these subjects. The third program, which is very relevant to the participants in this digital seminar, which is about healthy workplace, which is a pioneering program which recognizes companies or corporates for their commitment to employee health. In its more than 10 years of activity through 2019, 131 companies currently spanning over 3 million employees from both the private and public sector have been boarded as healthy workplace in Arogya's platform. Please connect me if your organization wants to be a Arogya's healthy workplace too. And you have my ID, which I would like to repeat here again, nandan@arogyaworld.org. So please connect me post session if you want to register for your organization. To set the context of digital seminar today, what we are conducting in association with CII. Now, as you know that now referring the current crisis of COVID-19, the coronavirus globally pandemic has affected every workplace in the country in one way or another. The lockdown has forced companies around the world to adopt new ways of working and doing business, which experts believe will become the new normal. And that's what we are going to discuss about today's session. This unprecedented crisis actually has reminded us of not only keeping our surroundings clean, but also taking care of our own health, eating healthy food, being physically active, and so on and so forth. The new concept of returning to work post-lockdown is now in the discussion and going to be a major challenge for all business leaders. I feel that priorities have to be carefully worked out and implemented as and when employees come back to work. With increasing worry and stress among employees, the organization role in sustaining employee safety and well-being will become the more important for every business leader than ever. In fact, in today's context and the digital seminar, we will be focusing more on critical insights from our esteemed leaders in the panel of progressive companies on how they plan to draw up the business continuity blueprints, keeping health and safety of employees in mind as a critical factor, which is the most important thing in the current scenario. We will have the panel discussion now for around 30 to 40 minutes. And then subsequently, we will open the platform for the Q&A. And I would request the participants to please forward their questions in the chat box so that that can be picked up in the panel and can be discussed. There will be few questions which cannot be answered in a due course of time, which can be further replied post the session. So without further any delay, we would like to now start the panel discussion. So thank you very much, Ram and Dr. Jairam while attending this session. And we'll open now the panel in this regard. And I would now like to request our esteemed panelists to please give their insights on the following questions, which we have framed it and we thought you will be the right people to answer. And I'm sure this is very relevant for the participants. So firstly, to start with, Ram, we would like to understand what are the key priorities of business leaders when employees return to work, Ram. For example, we are getting people, are you trying to get the people in phases? Which functions will operate or work from home, basically as per the critical to the organization from home as going to be the new normal? So how does it look like for the particular industry as general? Because today we have the participants from IT, ITS, manufacturing, and various other health industry organization. Sure. So we would request you to please throw your thoughts and lights on this point in terms of priorities of business leaders.
I think, first of all, let me thank you again, to Arogya World and CII for having me on this panel. Can you hear me okay?
Yes.
Am I audible? Okay, great. So I think you asked a very relevant question. I think I would like to frame it in two levels, right? One is as an industry, an IT industry. We pretty much all of us as a larger industry shifted to work from home. So we could argue that we never really stopped working, right? Unlike some industries where people had to stop working because of the fact that they couldn't be in the office or in their work environment. So for us, I think it's more a question of shifting the work environments back into the offices to a large extent. And I think to that, both from an industry perspective as well as from VMware perspective, our focus hasn't changed, right? Our number one focus is the well-being and safety of our employees, of our customers, and our partners. I think that has been the overarching goal from our perspective in terms of ensuring that all of these things happen. Having said that, we are also in an industry which has a world-reaching impact, and to a large extent, we have been supporting our customers through this crisis by helping them run their operations to a large extent, whether we are providers of technology or whether we are actually running their infrastructure for them, or as an industry, we are also supporting them through their, contact centers and various other things. So globally, we've been, enabling our customers to operate. Now, as we think about coming back into the workplace, I think our priorities haven't changed in that instance, in the sense that, it's about normalcy of operations. We need to continue to operate, whether we operate from home or we are moving back into the office. Our productivity cannot drop. That's number one, right? And to that extent, I think the government has been very supportive. There are specific regulations in India which prevent industries like us from operating from home, for example. And the government has been very proactive in enabling those regulatory frameworks to be relaxed to enable us to come back to work, right? So that's clearly, we'll continue to leverage that. As even as of yesterday, the Minister of IT has now, enabled this to be extended to end of July. So we are in no hurry to bring our employees back into the workplace for two reasons. One is we also have to adhere to all the norms that the government is putting in place in terms of social distancing and the ability to protect our employees. And the second thing that is coming up is the fact that our employees, we're leaving it to them, to their choice. It's not about forcing them back to work. We also need to enable our employees to have a choice of deciding when they want to come back to work, because it's not about us, it's about them to a large extent. So I think, we are of the belief, and of course, coming from a digital industry, we believe digital workspace is here to stay. And whether, people come back to the office or not, I think the norm, as you described it, the new normal is yet to form, in my opinion. And that new normal will have a digital backbone to it, for the foreseeable future. So that's the way we are thinking about our priorities.
Thank you very much, Ram. I think very insightful in terms of currently the focus, which has to be on the well-being and the safety of the employees, which is the critical part at this moment. And help customers to run the business is the most important, the challenge for all of us, and we need to support on that perspective. And as you rightly said, the productivity should not drop. I think all the efforts to be taken in terms of managing the enhanced productivity. So going back to Dr. Nandakumar, and my question to you, Dr. Nandakumar, is that what's your thoughts or your focus area in managing the safety, health, and well-being of the employees under current pandemic? As Ram has mentioned, that those are the key priorities. So what do you think your thought process in terms of corporates revisiting employee health and wellness strategy, or the process or the policies where some of the corporates, they don't have one currently? So what's your viewpoints on managing the safety, health, and well-being from the employee perspective?
Thank you. And again, thanks to CII and yourself and your organization for inviting me to speak. This pandemic has been a huge learner for many of us, including people in healthcare. But what is clear is that the pandemic has everybody concentrating only on the coronavirus. One must remember that other health conditions are not lost during this period. For example, a diabetic requires care of his diabetes, and hypertension needs to be taken care of. And that's the first and most important point that one has to remember as a healthcare provider, and also as corporates, to say that yes, it is vital and important that we concentrate on how to manage the COVID-19 pandemic and get it under control. We need to understand how to get the new normal into our lives as soon as possible. But it is equally important that one does not forget other health conditions which may otherwise ravage and cause greater mortality and morbidity amongst the population. I'm indeed surprised to hear that there are some corporates who do not have a healthcare policy. I would imagine that that is something that is vital, and one understands how important good health is in a workforce. It is indeed the one factor that could very well decide productivity and increase productive man hours. And therefore, it is vital that everyone has a healthcare policy. This policy should be directed towards, and I'll split this into two parts. One about the COVID and the other about other healthcare issues. And as I said, a very, very formatted and structured manner in which employees are directed towards control of non-communicable diseases is of extreme importance. I would say that this is important in two ways. One I've already alluded to. The second is one needs to remember that these people who have non-communicable diseases as well as age are also more susceptible to complications of COVID and to mortality as a consequence of this disease. And therefore, at this point in time, it is even more vital that these non-communicable diseases are kept well under control. Now, it would be too difficult for me to go into the details of the structure. Suffice it to say that there are enough opportunities for us in both the technology platform as well as in other measures such as electronic platforms to convey, control, and monitor health in an individual. Further to the COVID-19, I think the strong words are there in every single Indian's mind about social distancing, about hand washing, and all that goes with it to ensure that you remain protected during this period. However, it is vital that you remember that social distancing is not merely at your place of work, not at your desk. Social distancing means in the pantry. It means where you have your water cooler. It means in the loos. It is a 360-degree look at how to organize yourself with social distancing. It is also vital that how one wears a mask is more important than wearing a mask. I have seen ever so many people, even on the television, with a mask below their nose. This is not effective. A mask has to cover the nose and the chin. Explaining this in detail to the workforce, repeating it and ensuring that there is compliance is extremely important. And the last I would say is the manner in which you wash your hands. 20 seconds under the tap with soap and water. Make sure that every part of your hand is washed, including the thumb and the back. There are many videos demonstrating this, and I would suggest that corporates use these videos to ensure that this is dissipated to all their workforce. I would say health is a state of complete physical, mental, and social well-being. And that's the WHO definition of health. It is not the absence of disease. And therefore, at this period, it is also necessary that you look at enough relaxation of the mind. And I would come to that when we speak further, but it is important that one remembers that it is the state of health and not absence of disease that we should look at in our workforce. And that's briefly about what I would imagine is important for any corporate.
Plus 70, disconnected, ready to connect.
I think very relevant points you have mentioned today is about the managing the non-communicable diseases in terms of prevention of that. And health condition is the most important part in current scenario, which needs to be focused on, as you rightly said. Companies should have the healthcare policies if they do not have, and they should circulate to all their employees and ensure the adherence is being strictly done in terms of managing that. As you rightly said, I guess social distancing is again very, very critical, which has to be executed going forward. Managing the hygiene standards, again, is most critical thing. As you rightly said, the definition from WHO that the health is the mental and social well-being. I think it's a very, very important advice you have given today. And I'm sure all of us will adhere to that and will agree on that. So coming back to Ram on this critical subject. So what do you feel, what's your views and advice to the corporates, leaders regarding effective workplace management, majorly from the perspective of the corporate real estate, facilities, administration, human resource, and so on and so forth, which is emphasizing on employee well-being under the current scenario. As this is the most important point which has come up in this seminar today.
Yeah, I think Dr. Jairam raised some really relevant points in terms of what we need to watch out for as corporates. And I have to admit that I think most of us, almost all of us, have never been through a situation like this in the past.
Yes.
So to some extent, I think we are all learning together on the fly. And, for us, I think it's, and it's probably true for most companies, is that, how we process a lot of the new operating methods and new requirements that are coming up and new learnings, right? As Dr. Jairam points out, many of us probably are just, learning some of these, not just the terminologies, but the details behind them for the first time. So I think from our employee perspective, I think we are doing three different things. We're looking at it from a three-pronged approach. The first one is both the physical and digital infrastructure. For companies like us, I think both are critical. From a physical infrastructure, we are starting to put together the precautions and education for our colleagues, right? In terms of, we have teams in place to drive the response from the crisis perspective. We're ensuring that a secure environment is being created for back to work for all the things that were mentioned in terms of, social distancing as a 360. How do employees, how do they get food delivered to them during lunchtime, for example, or during other phases? How do we ensure that our lifts, which can be the, one of the most dangerous points of transmission of infections, how do we ensure that those things are managed properly? How do we ensure that, so infrastructure is a very broad theme. And then from a digital perspective, during all of this, we have to also ensure that we'll have colleagues who are working in a dual mode. Some may be in the office, some are continuing to work from home. How do we ensure that our digital backbones, infrastructure is continuing to operate? The second is from a physical well-being perspective, right? So how do we ensure that the comfort of the employees, as they, first of all, work from home? See, I think one of the things we are realizing is the actual work part, people have figured out how to make it happen. But where people are struggling is managing their personal lives along with their, work life, all in the same space. And to that extent, I think we're also realizing that, with digital tools like, Zoom and things like that, we never leave our chair. I mean, in the office conditions, you at least get up and walk around for a little bit. You may go to get a cup of coffee, right? So there's some break. But here we are clicking our way from one meeting to the next, from morning till night. And that is creating physical stress on people. So we are starting to give them more ergonomic support, both from an online perspective as well as offline. We are communicating with them, educating them on things that they could do, easily from within the confines of their home to actually be able to stretch and get a break, from the meetings that they're on. And then the third thing is we also realized through this process is not everybody's home is set up for a good work from home environment. Ergonomics, like, that we talked about, this could even involve things like, large screen monitors, regular monitor, mouse and keyboard. Everybody has a laptop. But working, especially for many of our engineers who are used to working with bigger screen, they need that kind of infrastructure to work. So what we have been able to do is, with the help of the passes that the police has provided, we've been able to get them those equipment to their houses, so that we can actually help them get, from an ergonomics perspective, at their homes. So physical well-being is another second area. The third area, as Dr. Jairam had also pointed out, is the mental well-being. So to that end, we have an employee assistance program. And what we have done is we have also extended it to their family members, because we are also realizing it's not just the employee, it's also the ecosystem around them, their families. Children are at home, they are doing their lessons digitally. We are working couple. So there's an immense amount of stress, and they have other, they could be caregivers for others in their home environment. So to ensure that our employee assistance program, we are making that available to the employees and to their families. Second thing we have done as a company is this year we have created something called a pandemic leave. So we have our regular leave, that we give to all employees. We've extended that this year so that they are able to take more time off if they need to be able to balance their home and work life, so that they don't get, they'll keep their regular employee leaves that they have, but we have given them additional days of leave so that they are able to do that. The third thing we have done is we have a fairly good touch point across our employees right from the time we started working from home. From our senior leadership downwards, we have touch points into the organization at various levels, so that we are able to hear what is happening at through the ranks of our employees and be able to mitigate that. So one of the things that we heard, which we have not done, is we have also educated our managers of these employees so that they are more flexible in allowing their employees to manage their own time, so that they are not pigeonholed into sitting through meetings all day long. We are giving them the flexibility to manage their own time as far as possible. So that's the other thing that we have done. And then we have also created employee engagement programs. So every week, our employee engagement committee has been doing recreational activities. So we had an Antakshari day, right, which was very well done, in the sense that we had not just employees participating, we had their families participating, we had their children participating. This week, we had a quiz program, and we are opening this up. I mean, one of the things that digital allows you to do is, we have offices all across India. We are enabling every employee to come together on that platform and participate. So we've had 800, 900,000 people participating in these things, and they're conducted by the employees for the employees. So there is an immense amount of interest and to be able to do those kind of things. And then last but not least, it's not just about us, right? It's also about our community that we live in. So as a company, we have a fairly elaborate giving programs that we enable employees to participate in and provide matching dollars from our end to our employee giving program. So we have actually doubled our pool of giving from a company side. So that, and then we work with a number of NGOs in India, for example, where employees either participate in person or they're able to donate to those NGOs. And through that, we also do a company level matching, so that we are also not just thinking about ourselves as a company, but thinking about the larger. So those are the three major areas that we are focusing.
Thank you, Ram. I think it's very, very insightful, and there are lots to learn from the initiatives which VMWare has taken. And I'm sure the most important thing today is about work-life balance, which every company has to ensure for their employees. And as you rightly said, I feel that the secure environment, digital infrastructure, which is the need of an hour, which needs to be established and which needs to be implemented in terms of managing work from home standards for the employees who are managing the business continuity. Comfort of employees, as you rightly said, is the most important thing, and we completely agree on that. In terms of managing current pandemic scenario, employee engagements initiative, which has been done along with families, where you're involving the family, is a great concept, and we all must learn from VMware and your thoughts and advice, what you have just said that. So I think very, very critical points and very valid in managing the current situation. I think giving back to the society is also very critical at this moment, and you are managing a lot of work with the NGOs and helping them and supporting them in this scenario is quite, again, appreciable in this regard. Coming back to Dr. Jairam, I want to understand in terms of what plans do you suggest that corporate leaders or the managers may adopt to train their teams, their employees, ensuring adherence to policy norms towards their safety, good health, and hygiene, which you have answered in your last question about that these are the three norms which has to be focused more on. So what do you suggest in terms of adhering the policy norms from the corporate perspective?
Right. Obviously, this is critical because creating a policy doesn't achieve anything. It is the implementation of the policy and the follow-up that really matters. So as I said, there are two parts to this. One is the protection that the staff have to take for themselves and their colleagues in preventing the spread of the coronavirus. That is one part. There is the other part of non-communicable diseases and other afflictions, which I've already spoken about. And I think the two of them should go hand in hand. One should not lose touch with one or the other. And therefore, the health policy should encompass both. Therefore, if a corporate does not have a health policy, it should create one. If there is a health policy, then it should be revisited to ensure that all the aspects that are mentioned are covered in depth. And this would be step one. Step two is to impart this down the line. And I would always suggest a top-down method of implementation. It is the demonstration of the top management and then flowing downwards in practicing each one of these. That will go a long way. Now, how is this to be done? It could be innovative and very, very different in different fields, but there are several aspects to this. Number one, the creation of a team of champions. These champions should be dispersed in different departments and different parts of the organization vertically, so that they in turn oversee, and I should not use the govern, I should use the word cajole the team members into best health practices. Punitive action or trying to be school teacher wise in ensuring these practices are adhered to it seldom if ever works. And therefore it is important that it becomes a way of life. And so if I could use the word, the new work etiquette should include each one of these. And this has to come from top down. For example, if the CEO of the organization were to shoot a video of himself exercising or of the kind of diet that he promotes for himself and his family, which is absolutely appropriate, then that creates an impact which is very different from asking somebody to look at a video and say, this is what you should be doing. So it needs to be a very, very progressive method of imparting this to the workforce. You'll be surprised that, in our own organization, some of the adherence to health policy comes best with the lowest in the rung of the organization. And I speak of those who are janitors and cleaning force who adhere much better than doctors. And therefore, one should not even for a moment imagine that the methods of acceptance and the need of acceptance is in the appropriate place. So I would say that, this is number two. Number three is a follow-up. It is not enough to just suggest this and look away. It is necessary that we as responsible corporates repeatedly reinforce this and also are aware of the changing scenario. In medicine, and I'm sure all of you would have had the experience of this or would be aware of this, requirements and appropriate therapy or preventive actions changes. And one can obviously talk about coconut as an example to say how it was taboo for some time and now it is completely changing and people are talking about how good and healthy it is and things like this. So one has to update this and be careful about ensuring that it is followed up. Specifically on the coronavirus, it is necessary that training is imparted to the workforce and to the champions. These champions must be trained and certified by appropriate authorities to say that they are in knowledge of this condition and are equipped to train others. So train the trainer kind of concept is quite important. Many of the aspects are not medical. If you look at it, it is preventive health, and preventive health can be learned by even a layperson. And therefore, this is something that can be done in any industry, anywhere in the world, and it would apply across equally in all other parts. So this is the third point that I'd like to stress.
Thank you very much, Dr. Nandakumar. I think very valid point again, what you have spoken about in terms of creation of the health policy, if the company does not have that, and the implementation of that plays a very critical role. and for which corporates can create the health champions, the team of health champions, or a trainer TTT program, which you rightly said will be more effective in this manner in terms of implementing that. And as you rightly said, I completely align that the leadership team plays an important role for adherence to the policies down the line, and they should be responsible for managing this and adherence strictly by 100% out of that. Coming back to you, Ram, on a very critical subject, which I'm sure all the participants will be eager to listen, is in terms of managing their clients, right? As you rightly said, that's the most important thing. So companies are now drawing up the policy for business continuity. So what do you think, what should be such an SOP prioritize in terms of points which would you like to talk about?
Sure. So I think most large companies have a business continuity plan of some sort. Even before this crisis, I think BCP plans are always, created and kept afresh. But I think one of the things that this crisis has brought about is that, no business continuity plan or a disaster preparedness plan is foolproof, right? Because most of them are created to, especially in an industry like ours, it's about geo preparedness. So, if there is a natural disaster in one part of the world, an office or a set of offices in other parts of the world will take over and run these things. That's typically how BCP plans are built, right? For most companies. But this crisis, everybody's on the same boat. Our headquarters is in California, and our colleagues there have been sheltering at home in the US almost as long as we have. So, so no BCP plan can take this into account. But we do a few things as a company which has helped us, I believe, right? One, we have a very elaborate crisis management team across the world. And this is, it's hierarchical in some sense, but these are people from our line organizations who work on some of these things day in and day out. And they're completely empowered to make decisions for the local geo and at a global level. So that leaves the leadership team to focus on running the business. So our leaders don't get involved on a day-to-day basis in our crisis management teams, day-to-day operations. They inform us, they take advice, but they are empowered to come up with suggestions and be able to drive that. I think creation of this separation has helped us a great deal in being able to scale to a crisis like this very quickly. The second thing that we have done is, of course, as we start to come back to work, one of the things will be implementing significant precautions to address the safety of colleagues and both employees as well as our partners and vendors who are in the office. And for that, our facility management team is leading the charge there in putting together our SOPs in terms of operations. They don't do it by themselves. They work across the business and other functions to ensure that we're putting together a 360 plan to address this as people start to trickle back to work in some sense, right? The third thing is keeping abreast of the global, recent developments. So, for example, our crisis management teams have healthcare partners who are part of that crisis management team. So they advise us on some of these things as well. So, for all the things that Dr. Jairam pointed out, we are no experts in this. So we need the professionals to be, hand in hand with us to help advise us in putting these SOPs together, because we don't want to come up with plans which are not implementable or scalable or doesn't address the need of the hour to a large extent. The fourth area is utilizing our internal social media platforms to educate, our employees, and using the collaboration tools and the two-way dialogue. For example, we do a lot of Zoom calls, within the organizations, and even smaller groups of people, within work groups have also started doing some things like, they have coffee chat sessions in the evening. It's not work related. They all get their tea and coffee, and then they sit and talk about, what's going on to, help each other through that process. And then last but not least is, utilizing our own tools. At the end of the day, we sell our tools to our customers as disaster recovery as a service. Today, we are living that, right? By actually using our own tools to actually manage our own infrastructure and doing all of the things that we're talking about. So we're living our own life or eating our own dog food to some extent. So our SOPs, it's not a one-time thing. We don't believe that. We also need to keep it agile in some ways so that, as we learn, it can be very quickly incorporated back into the SOP as we're developing.
Thank you very much, Ram. I think it's very relevant points what you have just pointed out. And I'm sure, we all learn from these best practices, which has been implemented by you as a leader in your organization and your other colleagues. As you rightly said, I think the line manager empowerment is most critical so that the leadership team can focus on the other aspects of the decision-making process in current pandemics. Establishing SOPs, again, very critical, but more than that is the implementation of that on ground strictly. I think employee engagement, you have already spoken a lot, and those are great initiatives which has been done by your organization. So thank you very much for your insights on these points. Coming back to Dr. Nandakumar, you come from the health industry. And Doctor, we would like to know that how to take care of health and mental well-being, which is most critical part at this moment, if work from home status quo continues going forward. As Ram has just mentioned that it's work from home now going to be till July end. So as we are seeing, it is continuing, increasing, the date is going, forward and forward. So how do you think how employees, how people can take care of mental and health and mental well-being in an efficient manner?
Sure. I mean, at the outset, I'd like to compliment Ram and his organization for the very innovative way in which they have worked on how to keep an employee engaged and mentally, if I could use the word healthy, by the very innovative ways. You see, all of us, I think, and some of us are probably many more years than others, are used to a certain work schedule and a certain lifestyle, which all of you will agree is very important for a satisfying life and career. All of us spend much longer hours at work than at home. We have our friends and we have colleagues who are interactive during this period. It creates a certain, if I could use the word, mental comfort that is very difficult to put down or pen down, but it has changed overnight, especially for some of us in industries where this has never been the norm. The IT industry at least had work from home to some extent because that was possible. For many of us, this is simply not the way. And therefore, it is important for us to understand that we need to establish a method by which we address these issues. And that is where I believe Ram's attempt at innovative
I do not associate with niggers. I do not associate with niggers.
Demonstrated in the way in which work from
I do not associate with niggers.
Has, I think there was some disturbance there.
The eco team will take that step immediately.
Right. So they addressed it. So, you look at it, there are three components to this. One is the physical component. The physical component of work from home implies that you must concentrate much more on staying well. I mean, you have to learn how to exercise within the confines of your home, at least until the lockdown is over, and not stop doing it. Physical exercise is one of the most important, and how one can do this is so innovative today. All you need is a YouTube, a cell phone, and your own place, and you can exercise without any gym instructor or anything like that. And this is so easy to do. So the first that I would say is keep physically well. Number two, and this happens to many workers at home, is binge eating or excessive eating simply because of the atmosphere and the stress of staying at home, working out of a single room, and in situations that are not really at their comfort levels. One has to avoid binge eating, and this needs to be stressed considerably because that has so many other effects apart from just putting on weight and losing control of various other issues. The third is the mental component. And the mental component is not just the fact that you're working out of home. The mental component is also lack of communication with colleagues, It is the stress of having to face possible adversity in your job in the long run because of, again, not looking at your workforce, not knowing what is going to happen in terms of the long run. And this requires a very different way of being addressed. It requires a person to de-stress, and de-stressing can be very different in different people. But one has to understand what is the best de-stressor for a particular individual and apply it to oneself. And therefore, all that we have to do is to encourage things like listening to music, practicing yoga, spending time with family, gaming with colleagues, or entertaining with colleagues, virtual coffee breaks. You know, the list is endless. And the third is to enable conversations between people out of the family. There needs to be an interaction with people outside, and lack of that interaction has its own and regularly deleterious effects. Finally, I would say it is valuable to have counseling services available to such people through the organization, because at taking advantage of counseling in especially the younger generations today is vital, not just for their well-being, but for harmony within the family and to ensure that they themselves stay more productive at work and they are able to rest well. The last point is sleep is as important as physical activity. I know it's very easy to say sleep well, but one should encourage adequate hours of rest and not watching movies or staying awake for hours in bed. These are not good practices at all.
Thank you very much, Doctor, for your viewpoints. And I'm sure, these are the best practices which can be implemented by all of us in terms of managing the mental comfort, which plays a critical role again. Doing the physical activity in terms of physically fit is again important thing. Physical exercise, as you rightly said, that can be conducted through online session and people can use if they have the trainers and so on and so forth. Also, avoid binge eating. I think this is a time when healthy eating plays an important role, and that should be implemented by all of us. Communication, as you rightly said, with the family members, with the team, spending time, again, will add on in terms of managing the situation. And, making yourself de-stress, again, plays an important role in this regard. Now, having said that, from the Arogya world perspective, when we are seeing the current pandemic and we are seeing the work from home, status quo continues. So what we have also done as an additional feature that as we are working from home, the impact of working from home on employees and their well-being is something which Arogya world is really concerned about. And we have been in touch with our 131 plus healthy workplace companies in the country. And to assist that, Arogya World is pleased to inform you that we have initiated the work from home survey link, which is adapted from the Institute for Employment Studies in the United Kingdom. You can please join us in this important exercise, and I would like to urge all the participants here and even encourage your employees also to take part as well. In fact, we will share the report with you post completion of this survey, which is by second week of May. And the result can help actually corporates and the country be better prepared for further pandemics and help them actually to make our workforce more resilient and more agile, as Ram has mentioned in his viewpoints. So you can please connect me post-seminar in this regard. It's also for more details and we can talk more about that. Now, in the interest of time, we will open the panel for the Q&A session for next, let's say 10 minutes. And if you're not able to answer, we will come back to you giving answers to those questions later part. So you can see the chat box, Ram and Dr. Nandakumar. I will try to pick up few important questions and, we'll talk. from Shri Ganesh, there is a question that apart from getting self-declaration and doing thermal checking, how do we check wellness of the employees when they return to work? So Ram, would you like to take this question?
Sure. I think we are still putting together our plans for this, but some of these are definitely what we are asking for is self-declaration and then thermal checks of the employee. But but we also are going to, one of the things we're going to do is also limit the number of employees who are going to be coming in initially. I think as an industry, NASSCOM had very specific guidance to member companies that I think in the first month or so, we'll be looking at, barely 15% of our employees, 15 to 30%, and then slowly open the aperture. And even in an end state, I think we are probably looking at not more than 50% of our employees back at the work, at the office, if at all, right? Like I said, we are leaving it also to our employees to manage for themselves in terms of their comfort about coming into work. We are also looking at putting rosters together so that, as we manage the 15-30% number, only the most critical employees who we actually have to have in the office to work, only they would be encouraged initially to come back, not everybody. So I think we are going to manage not just looking at it from in the workplace, but also the funnel of people who will be coming into the workplace. How do we ensure that, we are not overwhelming our own facility resources that we would have to be able to do that.
Sure. Thank you very much, Ram. Question from Bharat from Kargil, India. Any specific food diet plan as company can provide during its operation? Doctor, over to you.
I don't think there is anything specific that one can prescribe to say this is the best for you. It depends on so many factors. It depends upon the age of the employee. It depends upon comorbid conditions. It depends on whether he or she has diabetes and so on. So I would say there is nothing specific. There's no food that is enriched in such a way that it helps a person. It has to be tailor-made to an individual, and there are enough opportunities to do this by visiting a dietitian and getting appropriate advice.
So, Bharat, in fact, Arogya World is also having a flagship program of My Thali, where we are talking about the nutritious food diet. So you can connect us offline and we can further discuss on this particular subject. There is a question from Mayur. Mayur, what would be the impact on administration and facility professionals in terms of employment as new trained that work from home will be introduced by various sectors, due to which curtail in office space or others will be minimized? Would you like to take this question, Ram?
Sure. I think the way we look at our real estate and workplace professionals, they play a role that is not just facility management to a large extent. I think they are, some of the ergonomics things that I talked about, some of the employee engagement work that we talked about. These are led by our professionals. So we encourage them not to just be pigeonholed in terms of their role and how we define their role, but they are involved in every aspect of it. They participate in our crisis management teams. They participate, like I said, in our employee engagement programs. They participate in our wellness programs. We educate our employees in that. So they lead these efforts for us. So we don't think about them only as managing real estate, real estate professionals. Now, having said that, I mean, we saw TCS recently came back and said, they need only 25% of their employee base in the office, and they're actively going to look at how they will manage some of these. So certainly, I think, will there be impact? Probably. I think we need to start thinking about how to reframe the role itself to be much more broader so that they can bring a lot more value to the table and hence be valuable to the company in the long run.
Sure. Thank you very much, Ram. There is another question which talks about what are your views on, this is from Ajay Malik, practices to build employee confidence while coming back to office, and what are the basis or principles for rostering and ensuring social distance?
Sure. You want me to take that?
Yes, please.
Yeah. So I think, first of all, I think it's being transparent with our employees. I think we keep them abreast of everything that is going on. So we have constant communication with them, either a two-way dialogue or we keep them abreast. They get some form of communication from the leadership team on a constant basis, right? Second thing is, I think, we also try to ensure the fact that they understand that we are as much in the trenches with them as them. So it's not about us versus them. It's about our employees. All of us are employees as well. So I think, there's a collective feeling of we are one larger family, and this is our, our crisis to get through, right, to a large extent. In terms of rostering, I think we work very closely with our managers, with our leadership, to coming up with what are those critical roles that we must have in the office, and that will define who we would encourage to come back to office to work, right? So there are some very critical roles, for example, in our kind of industry, where you have certain kind of operations roles to keep the rest of the infrastructure running that cannot be done remotely. It needs physical access to certain kinds of machines or something else. And those kind of roles, we would need to have in the office. But even there, we would not want all of them there at the same time. We would ensure that there is a good, healthy management of time in the office versus time remote for them to be able to do their jobs. So those would be some of the factors that would play into deciding how that roster gets put together.
Sure. Thank you very much, Ram. I'll quickly take two more questions in the interest of time. And this is from Atul and goes to Dr. Jairam. What shall be the steps to operate a manufacturing unit if a COVID-19 positive case has been identified in the unit? Is there a guideline from government to handle the situation in a manufacturing space?
I am very clear that there is no guideline specifically for the manufacturing space. But what is clear is that if there is a COVID-19 patient in any industry, the following steps will have to be taken. Number one, obviously, that person would be out in a COVID unit, depending upon the severity of the disease, and the level of the unit would be decided. But the primary contacts and those who have been in the vicinity would have to be quarantined. Every part of that person's work area needs to be sanitized. There may be a need for the unit to be closed and sanitized completely, depending upon the nature of this workforce and the movements thereof. The government has been much more aggressive in closing units whenever there is a COVID-19 patient. And that is the way they have tried to restrict until they sanitize and reopen. In fact, they've done it for hospitals as well, where a COVID-19 patient has been treated without people knowing that the patient is a COVID-19 patient. So specifically for manufacturing units, I don't think there is a guideline as yet, but I'm sure it will come as the health ministry, both at the central and all the state levels, have been extremely proactive in creating excellent guidelines based on scientific information. And I'll be happy to share with Atul if I have his email the moment I have this.
Sure, we'll do that. Thank you very much. Ram, over to you. This particular question is from Srinivas Taluka. What are the key factors to be considered while drafting a new visitor standard operating procedure and visitor policy specific to COVID-19 post-lockdown?
For visitors, specific to visitors?
Yeah, visitor management in terms of the SPA policy.
So firstly, I think in the initial days, we would probably not encourage as many visitors coming into our office. And we would continue to encourage to have remote meetings with them if possible, right? Secondly, I think all the standard procedures we are putting in place for our offices and our employees would still apply to visitors as well. So we would be checking them for, self-declaration, any kinds of, checking temperatures, those kinds of things, if they were to come into our office. We may we would potentially limit their access to the rest of the office. In the past, when a visitor came, we would bring them into the office to sit in one of our conference rooms to have a meeting or something. We may limit the space availability to some of the visitors coming in to our office. But those are things that we are just, it's still work in progress in terms of definition. But those are kinds of few things that we are thinking.
Wonderful. Thank you very much. There's another question from Michael Anthony, which he says that what are the safety measures should be taken at workplace during this catastrophic situation? So Ram, would you like to take this from the workplace?
I mean, I can add to it, but I think Dr. Jairam may have more to offer for this type of a question. But
sure.
But I think all the things we have talked about, right, in terms of ensuring employees have sufficient space between themselves to work, How do we ensure that wherever there, masks are in place and compulsorily, and to Dr. Jairam's point, worn correctly, right? How do we educate them? Making sanitizers available across the floor. We are moving to things like touchless printing so that the people don't have to walk up to in order to touch any of the equipment to be able to do that. So those are the kinds of things to think about. It's a mixture of where technology can play a role, and also education and enforcement, and also constantly reinforcing some of the guidelines and ensuring that people are following those and checking that across there.
Sure. Doctor, you would like to throw some light on this question?
No, I think Ram has covered most of it, and a lot of our earlier answers were directed towards this.
Yes.
I think it is simply addressing that 360 degree. Like I said, not just your place of work, but ensuring that the standards are looked at washrooms, and there's adequate toilet etiquette, water areas, eating areas, and other common areas like pantries and so on, are especially areas that one has to be careful about. I would also suggest that sanitization of the workspace with 1% hypochlorite solution or chlorhexidine is advisable frequently in order that one doesn't have any virus on workspace areas. And the last point that I would raise is that, self-declaration and checking the temperature does not always mean that you are not dealing with a COVID patient or a COVID infection. And so it is these three: social distancing, sanitization, that is more important.
Sure. Thank you very much, Doctor. I will take the last question now, Doctor. And this is to you from Manoj Kumar Pati. He says that major operations for some organizations such as NGOs, especially in healthcare domain, deals with daily field operation. In that context, how to prioritize and make strategy for employees to do work from home for a prolonged period, and how to connect with vulnerable clients or patients, especially from the underserved geographies?
I think the answer is to look at teleconnections. Telemedicine, for example, is something that is coming up in a very strong way to connect with people who are in remote areas and in underserved areas, and to reduce contact between people. And so if you extend the same, it is through telecommunication that one has to do this. And this can be done through creation of apps, which are very easy and simple to do today, and use them to connect or to achieve whatever you require as a workforce.
Thank you very much, Doctor.
Hello. Looks like we may have lost Nandan's.
Yeah, hi, sorry, Ram, the power went off and I'm got disconnected, but can you hear me?
Yes, we
can.
Yeah.
Okay, wonderful. So what we will do now is we will take the questions offline and we will respond to our team members here from audience perspective. But in the interim, I understand that you have another call also. So I will quickly recap the session now by giving my thanks note. And we would like to now, be very, very thankful to all who have attended in our digital seminar, which is Return to Work Strategies, which we have discussed a lot of points, and I'm sure, audience have got a lot of key takeaways from this session. We would also like to, thank you and Dr. Nandakumar and Ramkumar for attending this session. Thank you very much for giving the insights. Special thanks to members from CII, GACS, Infra, CBRE and other corporates. Thanks to Mr. Loknath and Mr. Ramesh from CII and Arogya World Healthy Workplace team who have done a lot of efforts to ensure that this event goes successfully. In case you were unable to attend or would like to rewatch the seminar at your leisure, the recording we will share with you shortly, along with the seminar report by tomorrow. We look forward to bringing you series of webinar, and we are proud that we have associated with CII. And for the coming months, we are now formulating the important critical subjects and the topics in association with CII. And do watch this space for more details addressing relevant subjects of COVID-19. Till meantime, stay safe and healthy. And thank you very much once again, all of you, for participating in this digital seminar.
Thank you. Thank you.
Thank you, Dr. Nandan. Thank you, Mr. Nandan.
Thank you.
I just have a quick announcement. We would like to share a feedback form with everyone. Kindly request everyone to stay back for another 2 minutes just to fill up the feedback form. It will help us improve the quality of the sessions. So I'm just going to quickly share the feedback form. I hope it's visible to everyone.
I'm sorry, I can't see.
Yeah,
we can see that.
Yes.
Thank you, everyone. We're ending the session.